Well, he left the White House only 4 months ago. Now, former President Joe Biden is diagnosed with an aggressive form of prostate cancer. Biden's office says the 82-year-old and his family are now reviewing cancer treatment options. Biden writing on X, "Cancer touches us all. Like so many of you, Jill and I have learned that we are strongest in the broken places. Thank you for lifting us up with love and support." Biden's diagnosis now raising questions about his prostate cancer screenings while he was in office and if President Donald Trump has even been screened.
Can you say whether or not President Trump is screened for prostate cancer as part of his physical?
To the best of my understanding, he is, but we can certainly check in with the White House physician and go back and look at that physical report.
ABC News political director Avery Harper and ABC News medical correspondent Dr. Darian Sutton both join me now. So, Avery, at 82, Biden was the oldest sitting president when he left office in January after half a century in public life. He dropped out, as we know, of the 2024 race amid concerns over his age and his health. So what do you think the broader political impact of this news is?
Right. I mean, you mentioned it there. This really comes as Biden was making efforts to defend his own legacy. There had been a slate of books that were slated to come out that made allegations about Biden's mental acuity in the lead up to the 2024 election. And we've seen last week many Democrats asked about this, many shying away from talking about those allegations, many choosing instead to try and focus forward. I think in light of this diagnosis, we're going to see Democrats try to disengage from the conversation about Biden's mental acuity, about his cognitive abilities, and instead try to argue that they are wishing the Bidens the best and try to focus forward when we talk about the future of the Democratic Party, looking ahead to the future midterm elections and the coming presidential election rather than trying to relitigate 2024 and Biden's role in it.
So, Dr. Sutton, let's talk about how common this type of cancer is. And is it possible that he wouldn't have been having any type of symptoms and then all of a sudden realize he was at this stage?
It is very common, Kira. Nearly 3 million people live with this diagnosis, and an additional expected 300,000 will get this diagnosis. Prostate cancer represents just under 6% of all cancer-related deaths, and it is the most common cancer among men within the United States. Now, as far as his history, it's difficult to say. As physicians, we encourage patients to get early screening, that conversation hopefully starting in your 40s. The U.S. Preventative Services Task Force recommending to start screening at the age of 55, but conversations should happen before that. But then what happens after that can be different from patient to patient, depending on their past medical history, depending on those test results, and depending on factors such as their family history. So it is not easy to say what were the factors that we might have known about before that would have led to this, but very much similar to many patients who get this diagnosis, it is often a surprise. And even with certain levels of screening, unfortunately, there are still cases of cancer that can still get through.
Got it. Guys, thanks so much.